Hello medical terminology class, this is Geraldine and my project presentation is about the medical procedure colonoscopy. Colonoscopy is a test that allows the doctor to look at the inner lining of the colon. Colonoscopy is the visual examination of the colon using a colonoscope. A colonoscope is a thin, flexible tube that ranges between 48 inches to 72 inches long, about the thickness of a finger with a camera and a source of light at its tip. The colonoscope can be used to look at the whole colon and the lower part of the small intestine. Colonoscopy is done for several reasons. Most colonoscopies are performed as part of screening for colon cancer and also for screening colorectal cancer in people who have no symptoms. It is done to investigate the cause of blood in stool, abdominal pain, chronic constipation, chronic diarrhea, and a change in bowel habit or an abnormality on colonic X-rays or a CT scan. It is also used to diagnose growths. It helps to find ulcers, colon polyps, tumors, and areas of inflammation and bleeding. Colonoscopy can also be used to remove polyps, abnormal growths, and to collect tissue samples or biopsy for analysis. Since colonoscopy is a routine procedure, complications and risks are rare and usually minor. Some rare complications include bleeding from a site where biopsy was taken or polyp or other abnormal tissue was removed, but the bleeding is usually minor and can be controlled. It is quite unusual to require transfusions or surgery for post-colonoscopic bleeding. An even less common complication is a perforation or tear through the colonic wall, but even these perforations may not require surgery. Another potential complication is an adverse reaction to the sedative used. Complications from existing heart or lung disease may also occur. While these complications are rare, it is still important for patients to recognize early signs of a complication so they can notify the doctor immediately if they notice severe abdominal pain, heavy rectal bleeding, or fever and chills. Hello medical terminology class, this is Geraldine and my project presentation is about the medical procedure colonoscopy. If an abnormal area needs to be better evaluated, an instrument is inserted through the tube to take tissue samples or remove polyps or other areas or abnormal tissue to be analyzed. If colonoscopy is performed because of bleeding, the site of bleeding can be identified, samples of tissue is obtained if necessary, and the bleeding is controlled by several means through the colonoscope by injecting medications or by coagulation. If there are polyps, they can be removed through the colonoscope. Removal of these polyps is an important method in preventing colorectal cancer. Results are reviewed by the doctor, which may be given after the procedure. It may also take several days or weeks if there are abnormalities found. A colonoscopy is considered negative if the doctor does not find any abnormalities in the colon. In a normal result, the lining of the colon looks smooth and pink with a lot of normal folds. No growths, pouches, bleeding, or inflammation are present. A colonoscope is a thin, flexible tube that ranges between 48 inches to 72 inches long, about the thickness of a finger with a camera and a source of light at its tip. The colonoscope can be used to look at the whole colon and the lower part of the small intestine.